Sow parturition. Sow parturition or farrowing is the process that begins when the piglets reach their final stage of maturity within the womb. There are several stages of farrowing. Pre-farrowing period, farrowing, delivery of the placenta. The preparation for farrowing should be done before the actual due date. When there are clear signs that the farrowing is imminent. The signs that the farrowing is near are swelling of the vulva, developing of the mammary glands, and enlarging of the teats. As seen here. Signs of imminent farrowing. Signs also include restlessness and reduction in appetite. The sow will prepare a bed by moving straw around. Here we see a sow resting in their bed. The final sign will occur within 12 hours of the piglet's delivery. Milk will be secreted into the mammary gland. It can then be expressed using a gentle massaging motion. There may also be slight mucus discharge from the vulva. The last part of the pre-farrowing period is the dilation of the cervix. The opening that connects the uterus to the vagina. The cervix becomes dilated in preparation for the delivery. Here we see a piglet passing through the pelvis, about to birth. Nutrition for a gestating sow. When considering feed for a gestating sow, it's important to not overfeed. Overfeeding during early stages of gestation can lead to negative effects on the piglet's survival. Weight and medical history is an important factor for adjusting feeding amounts. During the last stages of the farrowing, increase feed to compensate for the growth of the piglets. Equipment list: a farrowing crate, creep and creep lamp, bucket and water, disinfectant, iodine, colostrum, medications. A farrowing crate is a specialized enclosure designed to stop the sow rolling onto the piglets and crushing them. A creep is a space specifically designated for the piglets to rest and keep warm. A heat lamp should be present to help the pigs maintain their body temperature. Parturition is a messy process. The piglets will need cleaning and the sow will need it as well. In preparation for the birth, the area for rest, both for the sow and piglets, should be disinfected to prevent spread of disease. In certain cases, the piglets might be too weak to feed. In this case, colostrum will be needed to make sure they develop their immune system. Medications may be required for both the sow and the piglets. This can include, but is not limited to, antibiotics, electrolytes, parasiticides and vaccines. Now we move on to the farrowing process. Here we see a sow ready to give birth. The farrowing process can last 3 to 8 hours, with piglets usually being delivered every 10 to 20 minutes. There can be a large variation in time span, and it's important to remember that each instance of parturition is different. There should be a person on hand who has experience with sow parturition in order to deal with any difficulties that occur. Farrowing problems may include uterine inertia, difficult presentations, rotation of the horns of the womb, stillbirth/mummified piglets. Uterine inertia. This is a condition where the uterus fails to contract during farrowing. There are several reasons for this. This can be caused by exhaustion, if the labor is particularly long. It can be caused by hormone imbalances. It can also be caused by the presence of dead pigs. Age, weight, and illness can also be a factor. Difficult presentations. Here we see the ideal presentation of a piglet exiting the womb. However, it will not always be this simple. This is called cranial presentation. In this instance, you would reach in, pull the legs forward and assist with the delivery. This is called caudal presentation. Here you would need to grab hold of the legs and gently pull the pig out. You may need to wiggle the shoulders if difficulty arises. This is called breech presentation. Here you would need to grab hold of the rear hocks and ease the pig backwards. Again, you may need to wiggle the shoulders if difficulty arises. This is called transverse presentation. Here, you need to gently push the pig slightly back, as you rotate it around, until the head and legs are facing forward. Then the pig can be removed. This can occur during especially large litters. One horn crosses over the other, causing an obstruction. This can be indicated by no pigs being delivered despite the farrowing being ongoing. This can lead to poor presentation in pigs and may need a vet or experienced handler to manually remove the pigs and attempt to realign the uterine horns for continued parturition. Trigger warning: the images you are about to see are of dead piglets. Some viewers may find this disturbing. Here we see stillbirth piglets. This occurs due to complications during the farrowing process. Stillbirth can happen because of infection, a long labor, uterine inertia and a number of other issues. Mummified piglets. Mummified piglets are those that have died earlier in gestation, usually due to an infection such as porcine parvovirus. Mummified piglets can also occur if there is insufficient space in the womb. This occurs with large litters. It's important to clearly identify when farrowing has finished. The sow will stop straining and appear at peace. She will also call to her piglets and let them nurse. If the mother is still straining, there may be issues with delivery and internal inspection may need to occur to guarantee all pigs have been delivered. The placenta will exit up to 4 hours after the last piglet is delivered. And thus farrowing is concluded. Thank you for watching.